Good morning, everyone, and welcome. Thank you for joining us today for this Welsh Government Centre event on the outlook for the Welsh Budget, which is due to be announced in a couple of weeks' time. I'm Michael Trickey, an Honorary Fellow at the Government Centre and acting as the MC for this morning. We'll shortly be hearing presentations from the Wales Fiscal Analysis team, Gito Ivan and Kian Sean. Their report on the outlook for the Welsh Budget is published today, and we are posting a link to the report in the chat box. So this has been an extraordinary time for fiscal policy as COVID has blown a hole through previous strategies. UK tax and spending plans have taken completely unanticipated direction in the last 18 months. But within that context, the coming Welsh Budget looks to be one of the more significant fiscal events in Wales for some time. It will be the first full budget since the Senate elections last May and the formation of a new administration. It'll be the first budget since the Chancellor's 3-year spending review in October, and the first since the signing of the 3-year cooperation agreement between Welsh Labour and Plaid Cymru. Any of these would be noteworthy events in their own right, but together they will provide a much more powerful backdrop than usual to the Welsh Budget, and will provide a substantial underpinning to the priorities and figures that the Finance Minister will set out, and it will set the direction for devolved finances in Wales for the next 3 years. Of course, there'll be considerable uncertainties. As we know only too well, COVID continues to loom over all decision-making. The outlook for the economy and the strength of the current recovery is still unsettled. There are questions about inflation and interest rates. Brexit is still working its way through. So even looking 3 years ahead presents challenges, and that's before we look at the underlying pressures on the NHS, social care, schools, and so on. We hope that the presentations this morning will help shed some light on the challenges, the choices which lie ahead, both for the Welsh Government and local government. So I'm going to ask Kian Ivan to lead off.
Diolch yn fawr, Michael. I'll just share my screen. Yeah, diolch yn fawr, and diolch i bawb am ymuno bore yma. Thank you for joining today. In terms of what we want to cover today, I'll firstly provide a brief overview of the economic and fiscal context as the Welsh Government prepares its draft budget for 2022. I'll then move on to an overview of the outlook for the Welsh Budget and what that might imply for the spending choices facing the Welsh Government. I'll then pass on to Kian to talk specifically about what it means for local government and local services, areas such as schools and social care, council tax and non-domestic rates, business rates, which will be key things, I think, to look at the time of the budget. I'll then be looking, lastly, at various funding pressures in the context of the overall outlook and what that might imply for funding new policies, and in particular those included in the recently signed cooperation agreement. So, first of all, on the economic and fiscal context, the OBR recently revised down its judgment on the extent to which the pandemic has done lasting damage or scarred the UK economy down from 3% to 2%. And that really provided a boost to the economic growth and boost to the public finances at the spending review. Of course, there are developments since then that will change that economic outlook, just highlighting again the uncertainty that forecasters are up against. On unemployment, there was better news in terms of expected peak of unemployment is now expected to be around 5.2% rather than 6.5% as forecast in March 2021. On that front, Wales has been doing slightly better than the UK average for a few years. There's also evidence of a faster recovery in employee numbers compared to the UK average in Wales as well. So on the face of it, the furlough cliff edge that was a major worry only 6 months ago has largely been avoided. Only a small share of furloughed employees were still on on furlough when the scheme was wound down a few months ago. On inflation, there's more worrying signs. The OBR forecasts that inflation is set to peak at 4.4% in the second quarter of 2022, before slowing to 2.3% in 23-24. Importantly, they also note that increases in fuel and energy prices since they closed their forecasts in September, they note that those increases are more consistent with inflation peaking at close to 5% next year. So far higher than what we're used to seeing, that we have been seeing over recent decades. Price increases make it a challenging outlook for households' finances, particularly in the context of tax rises and the recent reversal of the £20 a week uplift to universal credit, and of course has knock-on effects on the costs facing public services that we'll talk about later on. The improved economic outlook, however, significantly lowered forecast borrowing, because receipts is set to be a lot higher than previously forecast. And the Chancellor decided to use the improved forecast to increase departmental spending. And after the Health and Social Care Levy announcement the previous month, that was the second big upward revision to departmental spending in as many months. The Chancellor, if you remember, had cut back substantially on his pre-pandemic spending plans during the last 18 months, but now he's planning to spend £9 billion more on public services in 24-25 than what he was planning to spend back in March 2020, perhaps reflecting the impact of the pandemic on public services. Another key bit of context for the Welsh budget is that meeting the Chancellor's newly set fiscal targets for a current budget balance and to have debt reducing as a share of GDP, at the same time as increasing departmental spending. That's predicated on increasing the tax to GDP ratio to 36% in 26-27. That's up from 33% in 2019-20, would be the highest level for the UK since the 1950s and take the UK above the average for developed countries in terms of tax to GDP. And there are perhaps reasons to doubt whether the Chancellor will indeed follow through on that with that tax increase to such an extent, especially if you believe what the Chancellor himself has been saying. There are demographic, political and economic factors that are pushing the UK government towards higher taxes introduced this year. But a change in UK tax policy or fiscal policy will of course have big implications for the Welsh budget, as we've seen over recent months, and for Welsh Government tax policy, its own devolved tax policies later in this Senedd term. So moving on to the outlook for the Welsh budget. The spending review set the Welsh Government's block grants for the coming 3 years, and it will allow a return to multi-year budgeting and planning for the first time since October 2017. And of course, there was a big improvement given the increases made to departmental spending by the UK government since the March 21 spending plans. Under those spending plans, it would have been very difficult for the Welsh Government to fund the various spending pressures within the budget. So it's an improvement, but an improvement was on what was a very bleak outlook to begin with. If you exclude COVID-19 funding over the last 2 years, then core day-to-day spending is set to increase by almost £2 billion next year and by £2.9 billion by 24-25 in cash terms. Hence the UK government calling this a record-breaking settlement for the Welsh Government. Of course, if you do include COVID-19 funding this year, then spending will fall next year compared to the pandemic, the previous 2 years of the pandemic, because there is no COVID-19 funding planned for next year. What that means is that any pandemic-related pressures, which will still be there, will need to be funded from within a now higher core budget. To put that increase in context, what's shown here is the annual change in day-to-day spending in real terms from the start of devolution, and on what we think is a broadly like-for-like basis. Spending next year will grow by around 8.6% in real terms, given the block grant and devolved tax forecasts. That's up there with the highest year-on-year increase that we've seen during devolution. However, but that's followed by 2 years of almost no real terms growth. So it's very much front-loaded towards next year. And if we average across a longer time period from 2019 onwards to get rid of the volatility in the measure of inflation that we use, the GDP deflator, over the course of the pandemic, then we get an average of about 2.7% in real terms per year over that period. That is, of course, a step change from the previous decade, more in line with increases that we saw from 2004 to 2009. but it's lower than the first year of devolution. And what first years of devolution, what you didn't have over that first decade of devolution, of course, was the huge increase in funding pressures that we're likely to see as a result of the pandemic. So it's a very different context now compared to back then. In terms of comparisons to pre-austerity levels that we often present, day-to-day spending here, if you can see the trends in day-to-day spending in real terms since 2010, it'll be around 9% higher in real terms compared to 2010 levels next year. After accounting for population growth, spending on a per person basis will be around 4% higher next year. To illustrate what this means for the budget and the choices facing the Welsh Government, we can make illustrative allocations broadly based on following UK government decisions on spending in England. So looking at where the spending in England has taken place and what has triggered the consequentials coming to the Welsh Government. So the black dots that you can see there are the total increase to the budget that the Welsh Government can allocate for day-to-day spending in nominal terms, in cash terms, compared to the 21-22 baseline or core budget spending, so excluding COVID-19 funding. Firstly, we assume that the Welsh Government passes on consequentials from NHS England spending, while consequentials from other Department of Health and Social Care funding can also be allocated towards health costs. So that's over £1 billion in the first year, as well as over half of the allocations by 24-25. We then assume that funding specifically allocated in England towards adult social care reform gets used to implement reforms in Wales. That grows over time. I think in England it's about £5.3 billion over the 3 years. It grows over time to about £150 million of consequentials for the Welsh Government by 24-25. We then assume that the Welsh Government passes on consequentials from increased school spending in England to local authorities in Wales. So that's quite a large increase in core local government funding of 5.1% in real terms by 24-25, primarily driven by those schools' consequentials. We then assume that the Welsh Government introduces some tax policies on business rates, on non-domestic rates reliefs this year, and implements a freeze in the multiplier, or uses the funding from those changes by the UK government in England. And then we finally assume that the blue bars there, that all of the spending increases proportionally with the rest of the budget available. A big contrast, therefore, to previous budgets is that passing on consequentials to the NHS and schools and other priority areas doesn't mean this time that you have to find cuts in other areas of the budget. Other Welsh Government services can increase by about 2.7% in real terms in 22-23, although falling slightly after that. Just to reiterate that point on what makes this budget different, the outlook different, this again shows the real terms trend in all total non-NHS spending from 2010 onwards in real terms. And this part of the budget, of course, has seen real terms cuts as spending was cut and NHS spending was increased. Under this illustrative scenario, and assuming that some of the other health and social care department spending or the consequentials from that spending doesn't go towards the NHS, then total spending outside of the core NHS budget would increase substantially in real terms for the first time in over a decade, and partly reversing some of the cuts seen after 2010. But on this graph, as you can see there, non-NHS spending will still be about 5% below pre-austerity levels in real terms, and about 10% below on a per person basis by 24-25. So you can legitimately claim that this is an end to austerity, but it's definitely not a reversal of the decade of austerity policies that you've seen over the previous 10 years. If I turn quickly to capital spending, as shown here is the Welsh Government's capital block grant from 2004 onwards in real terms. The block grant will increase in nominal terms next year in 22-23, driven by financial transactions funding, which reduces in subsequent years. After the increases that we've seen over the course of the last Senate term, the capital block grant will in fact fall slightly in real terms during this spending review period. And that said, capital spending will be higher in the Senate term than compared to the previous 5 years, and it's sustained at higher levels and levels last seen in 2009 before austerity came in. So importantly, the Welsh Government will have some certainty around its multi-year settlement for capital, so it can better plan investments or that it will make over coming years. We also assume that the Welsh Government makes full use of its borrowing powers in each year. There are perhaps two areas to look out for on the capital side of the budget. Firstly, on climate change spending, estimates have been published recently by various organisations on the cost of net zero public spending. The OBR, for instance, thinks it'll be about 344 billion pounds before 2050 in constant prices. On a Welsh level, that could mean about 17 billion pounds spread over 3 decades. Of course, not all of that will be under devolved areas, but a substantial amount will be. And I guess this multi-year settlement provides the Welsh Government with an opportunity to plan its spending in this area, investments in this area over coming years. The second area is on health spending, and recovering from COVID-19 and clearing the backlog in elective care will require additional capacity and additional capital investments above pre-pandemic plans. And what we find is that increasing spending, capital spending in both these areas will mean quite difficult choices for other areas of the capital spending budget by 2024-25, given a declining capital block grant and very limited capital borrowing powers. So I'll now hand over to Kian, who will specifically talk about what this means for local governments in Wales. Diolch.
Cool, diolch Guto. So I'm going to talk about the funding and spending outlook for local authorities over the next 3 years. But to begin, I just wanted to briefly rewind back to March 2020 and provide some context on how local government has been funded during the pandemic. So in spring last year, it immediately became clear that councils would have to take on substantial new responsibilities, both as a direct result of the pandemic, but also because of government policy as well. So these included things like administering grant payments to businesses, responding to excess deaths, expanding homelessness support, and so on. And of course, these were all in addition to the acute pressures that were being felt on existing service areas like social care. Now, at the same time, some of local authorities' regular non-tax income streams, so things like car parking charges, revenue from council-owned bus services, they all began to dry up. And so from the outset, it was quite clear that there would need to be a rapid change to the way councils were funded. Now, in response, a large chunk of the settlement was paid in advance to local authorities last year to ensure they had sufficient cash flow to keep services running. And then the Welsh Government set up a Hardship Fund to fully compensate councils for their losses and additional pandemic-related expenditure. Now, the way this worked, at the end of each month, local authorities would submit returns to the Welsh Government, detailing the expenses and income losses incurred, and they would then be compensated as a result. We've heard a lot, I think, over the past 21 months about how policy responses have differed across the UK. And I think this was maybe a lesser known example of that. It was a completely different approach to what was done in England, where most funding was provided on the basis of upfront and very roughly calculated needs assessments. And this meant that some councils there were undercompensated as a result. Now, that wasn't the case in Wales. In 2020-21, £400 million was paid from the fund with respect to additional expenditure claims, and a further £190 million to compensate councils for their non-tax income losses. You can see from that chart that a large chunk of the additional spending was attributed to social services. That included things like overtime payments, testing in care homes, and so on. Now, initially, the Hardship Fund was extended only for the first 6 months of 2021-22. However, since then, it has been extended to cover some pandemic-related costs and losses until the end of this financial year. But what about the outlook for next year and beyond? Well, we published a report back in May, ahead of the Senedd election actually in May, outlining the challenges that local governments were set to face over the coming Senedd term. Of course, our projections of spending and revenue outlook have changed considerably since then. As we heard from Guto, there's been a material improvement to the public finances, and that means a better outlook for the local government settlements as well. However, the improved revenue outlook is partially offset on the spending side. So in the near term, inflationary pressures are likely to feed into higher input costs for local authorities. The latest OBR forecast suggests faster earnings growth in the near term as well. We know that the national living wage rather is set to increase by 6% next year. That will put additional pay pressures on social care providers in particular. And we also know that the health and social care levy will increase employee national insurance contribution rates as well. We estimate that cost to be around £27 million for local authorities next year. So these charts show our latest projection of local authority spending pressures over coming years. There's a lot of detail in the report about the methods and assumptions that we've made here. But for now, if we focus on the chart in the middle, you can see how much on top of their 2020-21 non-COVID baseline that councils will need to spend on different service areas in order to stand still in future years. Social services in yellow accounts for roughly half of all future pressures. And effectively what that means is that councils will need to allocate about half of all future spending increases to their social services departments in order to meet cost and demand pressures. That's driven both by demographic factors. We know that the over 65 population is projected to grow faster than the population as a whole, but also demand for children and family services as well has been growing particularly rapidly in recent years. The other key thing to highlight on this chart is that even in the absence of new public health restrictions, we do assume that some COVID pressures persist into future years. So particularly lower income from sales fees and charges, but also higher spending on adult social care as well. But actually that only has a limited impact on the overall amount of pressures going forwards. You know, even if you add on what might need to be spent on school catch-up learning costs, overwhelmingly, it's the core cost and demand pressures that are really driving up council spending requirements in future years. Now, of course, that could all change if new public health restrictions need to be brought in. Maybe we can talk a bit more about that potential scenario in the Q&A section. But in total, we project that local government spending will need to grow by around 3.9% a year over the next 3 years to meet baseline pressures in 2024-25. Because the pandemic-related costs are tapering away over time, the projected increase is largest next year and then smaller in the following years. You can see there that pressures for schools are likely to grow at a considerably slower pace. That's because of the forecast decline in pupil numbers. So in one sense, the Welsh Government has really benefited from this in recent years because it still receives the population share of the English school settlements, which is predicated on rising pupil numbers in England, even when the pupil numbers in Wales are falling. There is, of course, a separate question about the need for additional resources to fund catch-up learning programmes. So the Education Policy Institute in England has estimated that an additional £3.2 billion might be required over the next 3 years in England on top of previous announcements to recover lost learning time. That would equate to roughly £66 million a year here in Wales and would come on top of the 3.9% increase shown on that chart. Based on the indicative spending scenario Gitta outlined, which essentially tries to mirror what the consequentials have been spent on in England, principal council funding in Wales is projected to grow by an average of 3.8% a year in nominal terms over the next 3 years. That funding is front-loaded, as Gitta mentioned, which means that there is a considerably larger increase next year, followed by fairly actually modest real terms increases in 2023-24 and 2024-25. The chart on the screen is adjusted for inflation, and you can see that the projection does mark a step change from what we saw over the past decade, but Welsh Government funding to local authorities remains considerably below where it was in 2009-10 in real terms. Now let's take a look at what that means in the context of projected spending pressures. So next year, the increase in the settlement alone is likely to be sufficient to meet councils' core spending pressures and the ongoing costs of dealing with the pandemic. But as you can see, a funding gap does open up from 2023-24 onwards. And that means that in the absence of a more generous settlement than the one implied by our scenario, local authorities will need to rely on council tax increases to plug the funding shortfall in future years. If we include council tax increases of 3.6% a year on top of that, you can see that pressures can be met in each of the 3 years with some additional headroom next year. But that still wouldn't be sufficient to fully fund the spending that might be required on catch-up learning costs for pupils, which does suggest that additional resources might be required from the Welsh Government on top of the allocations implied by our scenario of passing on the school's consequentials, particularly from 2023-24 onwards. To try and put that council tax increase in context, a 3.6% increase, that would be lower than the last 4 years. It would be more in line with those seen during the early 2010s, when the local government settlement in Wales was partially at least protected from some of the steepest spending cuts. And actually, it might not be much higher than inflation next year, considering that consumer price inflation might peak as high as 5% in the new year. Now, of course, the Welsh Government could opt to allocate additional funding to local authorities over and above the amount implied by our scenario to mitigate the need for these large council tax increases. We might also see some welcome changes to the current tax regime over the coming years as well. A commitment to council tax reform was included in that cooperation agreement between the Welsh Government and Plaid Cymru. And I guess one of the advantages of the funding profile is that it might allow for smaller council tax increases next year, but then if you time that correctly, you could have larger council tax increases after the reforms have taken place. And that would help minimize the increases on lower income households and those that are disproportionately impacted by the regressivity of the existing band structure. Turning to the other local tax, non-domestic or business rates, the Welsh Government will need to make some important decisions here as well in later this month. £380 million has been allocated to fund a 100% rates relief package for qualifying retail, leisure and hospitality industries business premises this year. We do expect an announcement on whether or not that relief will be extended for another year in the upcoming draft budget. And the graph on the screen just provides some context. There are currently just under 55,000 retail, leisure and hospitality businesses registered on the local rating list in Wales. However, actually a majority of them already qualify for full rates relief under the small business rates relief scheme. And effectively what that means is the pandemic related relief has been mostly targeted at those businesses who are ineligible or only eligible for partial small business relief. And as you can see, most of those businesses operate in the retail sector. In England, the Chancellor announced that retail, leisure and hospitality premises will receive a 50% discount for another year, subject to a cash cap of 110,000. He also announced, as Gita mentioned, that the multiplier, which is used to uprate tax liabilities in line with inflation each year, that will be frozen in 2022-23. And we estimate that that has triggered approximately £160 million of consequential funding for the Welsh Budget next year. If you were to try and emulate that by offering 50% relief to all retail, leisure and hospitality businesses, that would cost roughly £250 million in Wales. But there are grounds for putting an upper cap on who might be eligible for that relief. So the 110,000 cash cap in England, that's equivalent to roughly £205,000 in terms of the rateable value, the equivalent rateable value in Wales. If you set that as an upper threshold, that would halve the cost of the policy to £125 million, while still allowing you to support around 25,000 businesses next year. Freezing the multiplier would cost £42 million. But actually, even if the multiplier isn't frozen next year, because it's calculated using the CPI index from the September preceding the start of the financial year, the inflationary pressures that are happening right now, those actually won't be reflected in the multiplier until April 2023, so the year after next. And a slightly more technical point, the Chancellor also announced that the gap between revaluations in England will be reduced from 5 to 3 years going forwards. Now, in the past, the Welsh Government has made changes to its revaluation schedule to align itself with England. So it'll be interesting to see whether they intend to do something similar here as well. And lastly, we do expect to see some progress on social care reforms over the coming years. The Welsh Government will receive approximately £600 million because of the new health and social care levy each year. It will be up to them how to allocate it between the NHS and social care providers. But if we assume the same split as in England, that leaves approximately £150 million to implement reforms of social care in Wales in 2024-25. And that would be in addition to the funding that I outlined earlier. However, any reforms will need to address more than just who pays for care. We know that low pay is endemic in the care sector. The majority of care staff in Wales are paid less than the real living wage currently. Not only is that current situation unfair, but it also has an impact on staff retention and long-term workforce planning as well. So presumably some of that funding will need to go towards better pay and conditions for the care workforce. Whatever reforms are selected, local authorities will need to be properly compensated for any additional costs. So LE Wales estimated that the cost of implementing free personal care along similar lines to Scotland would be around £190 million in the first year of its implementation. That's broadly in the same ballpark as the funding from the levy, but I should stress that there's a lot of uncertainty around that estimate. We do know that when free personal care was introduced in Scotland back in 2002, the cost was initially underestimated in the planning group report. And that was basically in part because of the lack of reliable data on private care provision and also uncertainty about how many people would switch from receiving informal care to receiving state subsidised care once these reforms were implemented. And unfortunately, we don't have very good data on that in Wales either, so we could run into similar problems. Lastly, one thing that I think has been overlooked in all of this is the impact of the policy, and particularly the accompanying tax changes on different age cohorts. It is, in a way, regrettable that the UK government decided to raise national insurance rather than income tax to fund these reforms. Unlike income tax, national insurance contributions aren't paid on unearned income from investments, rents, pensions. And so the proposed arrangement in England is tantamount, as it currently stands, to a transfer from working age individuals to asset-rich pensioners. I guess one of the novelties of Holtham's proposal for a Welsh-specific social care levy was that it did seek to address and ensure fairness across age cohorts by varying the contribution rates by age. So even though it's true that the Welsh budget stands to benefit from the decision to raise taxes at a UK level rather than relying on the devolved tax levers, the downside, I guess, of that is that you don't get a say on what should be the distributional impact of the accompanying tax rises. I'm going to finish there and hand over to Gitta to talk a bit more about the cooperation agreement and to summarise. So over to you, Gitta.
Diolch, Ian. Share my screen again. So I'll just briefly to finish off on covering other funding pressures on the Welsh budget and talk about the scope for new policies like the ones that are mentioned in the cooperation agreement. And I guess the obvious place to start maybe is the largest area of the Welsh budget, which is the NHS. And I'd like to run over some of the funding pressures that we've included in our report from the direct and indirect costs of COVID-19. But first of all, we can project what we think are underlying pressures on the NHS and from rising costs and demands. As a baseline, we use the Health Foundation's estimate of funding pressures. They estimated back in 2016 that those amounted to 2.2% in real terms per year. We make slight adjustments to that based on our assumption on productivity growth, and we assume that the 3% pay rise awarded this year is carried forward to future years. We also include an estimate of the cost of the health and social care levy for NHS employers in 2022-23, about £50 million. However, given the impact of the pandemic on staffing and recruitment needs over coming years, we model an additional 1% per year increase in pay rises, taking it to 4% per year, and the cost of which builds up over time, just to illustrate that higher pay rises may require additional funding or increase cost pressures. Of course, it could be a lot higher than that, given the context of the pandemic and the impact on staff during the pandemic, and of course on the relative trends in NHS pay since the start of austerity in 2010. There are likely to be continuing large direct COVID-19 costs over coming years, treating COVID-19 patients, the test and trace and protect program, additional PPE on top of baseline requirements, and of course revaccination efforts over coming months and years. We make a simple assumption that those direct costs reduce over time in 22-23 and 23-24, from about £850 million this year. So broadly in line with other studies published for England on a population basis over the next 3 years. So the pandemic has also had a substantial impact on productivity in the NHS. Social distancing and heightened infection control reduces the amount of healthcare that you can provide, or services that you can provide given a level of inputs. We follow the 1.2 hit activity across NHS services over the 3 years. Of course, that could be higher. Other studies have found, think that it could be higher, especially next year in 22-23. Our assumption means that cost pressures of about £100 million per year over the spending review period, and it could be a lot higher, as I said, based on if the productivity hit is larger on NHS services. Next, the Welsh Government will need to fund post-pandemic recovery and clearing the backlog in elective care. The total waiting list for elective care has grown by around 45% since January 2010 to September this year. We think that could increase substantially again, particularly if missing patients from the last 18 months come back into the system. So from March 2020 to February 21, there were about 447,000 fewer referrals relative to the same period in 2019. So the extent of suppressed demand and how and when that materialises will be one of the key uncertainties facing the NHS. The Welsh Government has allocated recurrent funding of £195 million a year for emergency and planned care. That was in line with our projections from April on reducing the waiting list over a 4-year period. But again, that was based on our assumptions on the number of missing patients returning, or the share of missing patients returning, and on the cost per patient. And that could be a lot higher, for instance, if costs per patient end up being higher because cases are more complex or more costly to treat. Lastly, we make assumptions about new demands on mental health services. So in line with modelling in England on the surge in mental health services over coming years. And lastly, we make some potential savings, or model potential savings, based on assumptions made by the OBR and from the IFS Green Budget in England as well, from excess mortality and the effect that's had on demand, and on the effects of different ways of providing services that have come into force over the pandemic, and that carrying forward. If we compare that then with the consequentials that are coming from the NHS spending in England, then that funding should be sufficient to cover funding pressures, or given our assumptions, especially if we include some consequential funding from other health and social care spending, the Department for Health and Social Care spending, and the consequential funding coming from that. The warning, of course, on that front is that each of those funding pressures could vary significantly from the assumptions that we make here, and a lot can change over the next 3 years. So we've already heard from Kian on the pressures facing local authority services, and I think a key question is how much those pressures should be met by central funding as opposed to council tax increases, as Kian said. Outside of those two areas of spending, there were large allocations made to deal with the effects of COVID-19 over the last 2 years. The key unknown is perhaps how those funding pressures will evolve over coming years. That depends, of course, on the course of the pandemic. We estimate that there is some uncommitted funding in the budget this year, and some of these pressures may be around for some time. So, for example, support for public transport will need to be continued if passenger numbers don't recover over the next few years. The Welsh Government may also want to support businesses and boost skills spending during the economic recovery. And of course, we've seen interventions to support low-income households during the pandemic, the extra allocations to the Discretionary Assistance Fund, the winter fuel payment that was announced last month. And given the outlook for the cost of living, then maintaining or expanding those cash and in-kind support could be an important part of the discussion of how the budget supports low-income households over coming years. And I guess the next question is, given these funding pressures across all areas of the budget, where does that leave funding for new policies and expanding devolved public services? The cooperation agreement includes a number of additional spending commitments. I think primarily on free school meals for all primary school pupils, that could cost around £186 million a year on top of the current system. The expansion of early years childcare to include all 2-year-olds, we think based on current levels of spending could cost around £40 million a year. And of course, the ambition for a national care service free at the point of need, as Kian mentioned, could be a substantial commitment. Financial commitment. How feasible are these policies given the pressures and outlook? And we can go back to this chart again, and instead of following England like we assumed last time, we can begin to break down the different funding pressures based on our assumptions that we make. So specifically, we assume that the Welsh Government funds our central assumptions of NHS pressures from 22-23 to 24-25. That would increase health spending by over £1.5 billion by 24-25 in cash terms. We can assume that local government funding is increased slightly from our last scenario, so that funding pressures can be met, including some catch-up schools funding, can be met with council taxes of only 3% compared to the scenario that Kian laid out. And then finally, we can assume that all other Welsh Government spending outside of the NHS and local government funding grows in line with population growth and inflation. So that doesn't include any other COVID-19 costs this year or in future years. NDR, we also make the same assumption about NDR of consequentials from NDR business raised policies in England being passed on to businesses in Wales as well. So if you add up all those spending pressures that we've included, in the context of the overall increase, there appears to be some funding left over for above the funding pressures. And that should provide space to fund the policy proposals included in the cooperation agreement and expanding public services, or perhaps funding pressures that may arise that we haven't included here. So again, the warning, the health warning, maybe along with these projections, should be that those funding pressures could easily end up being a lot higher, and the headroom is smaller against those funding pressures is smaller by 24-25, and a lot, of course, will change by then. And in the medium to longer term, the sustainability of new funding commitments and public services, Welsh public services in general, will be subject to what happens to UK government fiscal policies, which can change quickly, as we've seen over recent months. To finish off, therefore, unlike recent years, the Welsh Government does have some certainty to plan its budget over multiple years, and the trade-offs between different areas of the budget are perhaps arguably less acute than for budgets during the austerity years of the last decade. And perhaps for the first time in a decade, we can begin to talk about new funding, new policies, and expanding services without having to find cuts elsewhere in the budget or leaving funding pressures unmet. But there are perhaps two factors that temper that rosy outlook for the Welsh budget, namely the lingering uncertainty surrounding COVID-19. Of course, that's been magnified over recent weeks, and the huge funding pressures facing most of the Welsh budget, as we've talked about, in what is a challenging economic context with inflationary pressures. In that context, I'd imagine that the Welsh Government will keep a significant amount of funding unallocated in its draft budget later this month to respond to the various funding pressures as they arise. And it'll be interesting to see how it deals with the implications of new policy commitments in the budget. Lastly, just to reiterate, the experience of recent months has again shown that the huge impact that UK government fiscal policy can have on the Welsh budget outlook. And the UK government's turn towards tax increases and higher departmental spending has transformed the Welsh government's ability to meet spending pressures and expand devolved services over coming years. When thinking about the longer term sustainability of the Welsh public services, Welsh policymakers will need to be mindful of potential future changes in the direction of UK fiscal policy and what that will mean for devolved fiscal policy and devolved tax policies as well going forward. So I'll leave it there. So hopefully I'll leave a bit of time for any questions.
Well, thanks very much, Peter and Kian. As we covered an awful lot of ground in the presentation, so just to remind everybody that we've sent out the link to the report that Gita and Kian are publishing today, and the slides will be all on the website if they're not already on the website. So an opportunity for people to take a sort of a more leisurely look at the ground that we've covered. So we're very happy to receive any questions. Just want to start off with a question about, somebody wanted to confirm the figures on the net zero capital commitment, and which I think comes from the starting point. I think it's the OBR assessment of 344 billion by 2050. Is that right?
Yeah, so they looked at, in their fiscal risks report from July, they looked at the total cost of decarbonising the UK economy and then making an assumption of how much of that cost will be borne by the public sector. So they came to the figure of £344 billion for the UK as a whole. And that's over 3 decades to 2050 in 2019 prices. So what I mentioned there was if you take a population share of that, that's about £17 billion over those 3 decades. So not per decade, but over the total period. Of course, not all of that, as I said, will be devolved areas. There's some public transport, some housing areas that will need to come from inside the Welsh Government budget. There was a report from I believe the New Economics Foundation that looked at the costs of decarbonising Welsh housing stock. So I think it's quite difficult to put a figure on it and compared to what's happening at the moment and what's in the budget already. Kind of the climate change budget as a whole is the largest part of the Welsh capital budget, and that portfolio, including transport, including housing, and other climate change related spending. But we do think that that type of spending will need to be ramped up over coming years. But again, set against a declining capital block grant is quite a difficult outlook for capital spending, we think.
Yeah, I mean the capital budget in a way looks even more challenging than the resource budget does this year. With David Phillips, our colleague at the IFS, has asked a question about the front loading. I just read it out. The front loading of the increases in funding would appear to be related to assumption that the remaining COVID-19 related pressures would also be front loaded. I wonder if it's possible to smooth the increase in funding over the spending review period to get an average real terms increase. Do you want to answer that now,
Yeah, I think off the top of my head, I think it is. Yeah, I think it is an useful way of looking at it. I think off the top of my head, given that it's increasing by about £2.9 billion by 24-25, I think about half of the increase next year, the £2 billion increase next year, you can see is slightly less than half will be the amount maybe that you can see as the core increase, the annual core increase to 24-25, and then the other half being COVID-19 pressures. I'm guessing that the Welsh Government would be doing a similar exercise in terms of when it sets its budget, looking at what's COVID pressures and what's underlying pressures, and and how it allocates its budget. In terms of the funding it provides local government, it might be a sensible way of smoothing out the increase over the 3 years and then providing additional funding this year. I'm not sure what Cian thinks about that, but that's certainly a different way of looking at it. But I think an useful way.
Yeah, I mean, just to add to that, obviously the Welsh Government is constrained by how much it can carry forward from year to year. So how much they expect to receive in each year is still important, obviously. I guess for councils, they do have the option of using their reserves to smooth out some of that funding over future years. However, I think the headroom, although there was a headroom with 3.6% council tax increases next year, it was still relatively small. And certainly if you add on top of that the expectation that they would fund the school catch-up spending from their own council budgets, that pretty much eliminates any headroom. So yeah, I guess, yeah, you'd be able to smooth out the funding over time using reserves, but I'm not sure how much of an impact that would actually have.
Okay, well, thanks very much. An interesting discussion to carry on with David offline, maybe. So thanks for the question, David. One from John Ray. Are there any negative impacts on the budget through the block grant adjustment?
Yeah, I can take that. In the report that we published immediately after the spending review, we looked at the new OBR forecasts for the devolved taxes over coming years, and then look at the forecast for comparable revenues in England, Northern Ireland. And that's important because the block grant adjustment, the amount taken off to reflect tax devolution, is linked to what happens to revenues in England and Northern Ireland. Is sort of a reverse of the Barnett formula on the taxes side. So what matters for the Welsh Government is the reverse, the relative growth in the tax base compared with what's happening to comparable revenues. We think that the Welsh tax base is actually doing quite well relative to the UK, to those block grant adjustments, and it'll have a positive effect on the budget. From what I saw yesterday, I think it's a different situation in Scotland. It's quite interesting, the contrast between the Welsh position and the Scottish position. Of course, they are forecast and they could change. So the block grant adjustments are increasing over time, but the devolved taxes are increasing at a faster rate, we think, over the next few years.
I mean, this is kind of unexpected, isn't it? 3 or 4 years ago, people weren't expecting that pattern to emerge. Do we have any sense as to what's driving this?
So I think based on the assumptions being made by the OBR, some of it, I think, is the fact that the frozen income tax thresholds having slightly higher, more of an effect in Wales. I'm not entirely sure what sort of Welsh specific elements that they're putting into their forecasts and whether it's possible to break it down in terms of what their assumptions about the Welsh economy might be. But it's partly contributed by the income tax threshold freezes. At the same time, I think probably the model used to calculate the block grant adjustments doesn't, in the Welsh case, suggest for population growth, and that was a particular concern, given that the Welsh population has been growing slower. It's actually quite interesting this year, for the first time, I think, for about 20 years, the Welsh population didn't increase faster than the rest of the UK, because of the effects of the pandemic, and whether the impact on that on going forward might be quite interesting to keep an eye out on.
Yeah, thank you. Those are the questions. I just wondered, Cian, if we just kind of finish off with just some reflections on this concept of a national care service, and what might lie behind that in terms of spending pressures.
Yeah, it's a good question. I mean, for our spending projections, we've essentially assumed that in some form or other means providing free personal care to those in a domiciliary and a residential care setting, along similar lines to Scotland. Now, just to clarify, that wouldn't cover all care costs, but just the elements attributed to personal care. So people might still be expected to pay for the sort of the accommodation elements of being in a care home separately. Yeah, so the cost estimates for that was around £190 million in its first year of implementation. I believe that in the LE Wales report, based on the modelling they did, they had a lower scenario of 135 million. That's if you assume less of a switch from informal care provision to receiving state-funded care. And that really is the difficulty with all of this, because we don't really have a good picture of what the private market for care is in Wales. And also, the extent of informal care services and people's preferences, and whether that would change, with a change of policy. I do think it's something I mentioned in my presentation, but I do think that there will need to be some funding made available for improved pay and conditions, particularly given that the OBR now are forecasting quite strong earnings growth, particularly for lower earners in the near term, in order to retain staff, in order to ensure that you do have capacity. I think it will be critical that some of that funding will go towards improving conditions for the workforce. But yeah, I think the cooperation agreement said that they were going to report back at the end of 2023, I believe, on what the final proposals would be. So I guess we can maybe revisit that then in terms of what that might actually cost.
Thank you very much. Okay, well, we're bringing the session to a close now, but thank you all very much for joining in and staying with us. And as I said, the materials that we've been covering today will be available on the Government Centre website, and we shall look with interest to see what actually happens in 2 weeks' time. I just want to just to say a word of thanks to the funders who support the work of the Wales Fiscal Analysis programme. That's as well as Cardiff University. We also get invaluable help from the Welsh Local Government Association, the Society of Local Authority Chief Executives, the Welsh Government and others. So just to thank all our funders for the support that we've received. And thank you all very much for joining us. And thank you and goodbye.